assessment and make sure I have my necessary supplies outside of the room. I'm not wearing my shoes just because I wear them to clinical and they're really gross, and so I didn't want them in here. But normally those would be on. Okay, so knocking on the door.
Hi.
Hi, my name is Celia. I'm going to be your student nurse today. And we're just going to be doing a simple head-to-toe assessment. But before we get started, can I just get your first name and last and your date of birth?
Cody Taylor, 718XX.
Okay, great. And then do you have any allergies, Cody?
Yeah, I'm allergic to codeine.
Okay, and then what's your reaction?
I can't breathe.
Okay. Okay, I will note that. I'm going to raise the bed to a comfortable working height at this point, and I'm going to just start with asking why you came in today.
My stomach's just hurting a little bit.
Okay, so on a scale of 1 to 10, what kind of pain, 1 being the least and 10 being the worst, where are you at?
I'm at like a 2.
Okay, and you said your stomach was a location, and is it like a dull, throbbing, aching, cramping, shooting?
Cramping.
Okay, cramping. And so is that an acceptable level of pain today, or?
Yes.
So we can continue on with the assessment?
Yes.
Okay, great. First I'm just going to start with taking some vitals. I'm going to be doing a 2-step method on you. Okay, so I'm going to clip this here, and I'm just going to feel. Okay, so I stopped feeling at 110. So I'll raise it up to 140. But in the meantime, I'm just gonna leave that on and get your temperature. So can you just open up and I'm gonna place this under your tongue. Beep, beep. 98.7, so that's normal and that's good. I'm gonna also just take your pulse right now. Okay, so for your pulse, I got 62 beats per minute, and your respirations were 15 breaths in 1 minute, so that is normal. Good. I'm going to now complete the 2-step blood pressure. Okay, 110/80, which is within normal limits, so it's normal. All right, I'm gonna just remove this from your arm now. All right. Okay. so I know I asked you what your name was, but I'm just gonna go ahead and ask you again. What is your name?
Cody Taylor.
Okay, great. And then, do you know where you are?
I'm at the hospital.
Okay, and do you know what year it is?
It's 2020.
Okay, and who the president is?
Donald Trump.
Okay. And so my patient is alert and oriented ×4. And now I'm going to assess your pupils. So just look at look at my nose while I do this. Okay. Now I'm just going to ask you to follow this pen without moving your head, just to track it. Okay, so your pupils are equal, round, and reactive to light, and they also do accommodate. I'm just going to check your mucous membranes really quickly in your mouth, if you don't mind opening up. All right, so those are pink and moist and looks to be well hydrated. I also didn't notice any damage, loose or missing teeth. Okay. Now I'm going to do some grips, pushes, and pulls on you. So if you can just grip my fingers and then push on my hands and then pull. Okay, those are all equal and strong bilaterally. And then now I'm going to do your skin because I already did neuro. Okay, so for your skin, I'm just going to check your turgor. And that is negative for tenting, so you are hydrated, well hydrated. I'm going to check your cap refill, which is less than 3 seconds. And I'm going to take note of your skin right now that I can see. I'm looking for any alterations or skin integrity, which your skin looks clean, dry, and intact. It's warm to touch, and the color is uniform and correct for the patient. And then now I'm just going to be listening to your lung sounds, if that's okay. Okay. Are you short of breath or have a cough today or anything like that? Okay,
No.
great. I didn't notice. Just wanted to ask. Okay, so just breathe in. And breathe in. Okay, great. And then I'm just going to listen to the other areas, but okay. All right, so I listened to the first two and noted that they are all regular rate from what I took with your respirations before. They were consistent with that. The depth was good. It was equal and symmetrical and regular. Okay, so if you don't mind just sitting up just a little bit. Okay, great. I'm now going to assess posterior side of your lungs. Can I just get you to breathe in? Okay, great. And then one more time. Okay. Okay. And then also at this time, I would just note the back of her skin integrity. It is clean, dry, and intact. I'm not noticing any wounds, bruises, or alterations, and it's warm to the touch, and it looks good. Okay, so with the lungs on the back, I noticed clear lung sounds. Same with the front, clear lung sounds. Rate was consistent with the respirations I took. The depth was good for my patient and also symmetrical. Next, I'm going to listen to your heart. Before I start, I just want to ask, do you have any chest pain?
No.
Okay, great. So here I'm just going to identify the different spots of the heart. So aortic, pulmonic, herbs, tricuspid, and mitral. And then I'm going to be listening for the S2 sounds I'll hear at the aortic and pulmonic, and S1 I expect to hear strongest at the mitral. Okay. So her heart sounded good. The rate was regular, and the rhythm was also regular. And then you did identify all of the parts of the heart. I'm gonna note for edema right now on the upper extremities, and I'm not seeing any or feeling any pitting or non-pitting edema, so that's good. And then now I'm just gonna identify and palpate the arteries. Do you mind if I remove your blankets?
No.
Okay. So I'm going to start here with the carotids, which I would never do at the same time, one and then the other. Okay. Brachials right here. And then radial, I'm actually going to palpate. Okay, I'm noting that those are +2 and equal in bilaterally. Femoral, which is right here, popliteal. Posterior tibialis. And then, do you mind if I remove your socks?
No.
Okay. So I did posterior pedal. And those are also +2 and equal in strength bilaterally. I'm going to also right now just do cap refill on your toes, and those are less than 3 seconds, so good perfusion. I'm going to have you push on my hands and then also pull back. So I'm noting that her pushes and pulls are equal and strong in strength bilaterally, so that's also good. I noted the cap refill, and I'm also going to assess the lower extremities for skin integrity, make sure there's no wounds, lacerations, or bruising, or any unnoted scarring or anything like that, which I don't see, so that's good. And I also am going to feel for edema, and I'm not getting any pitting or non-pitting edema. Okay, so at this point, I'm just going to put these socks back on so that you can walk in a little bit safely. Okay. Okay. All right, I'm gonna put this blanket back on you for a little bit. Okay, right now I'm gonna listen. I'm gonna look at your abdomen. Firstly, have you been passing gas?
I have been passing gas.
Okay, great. And at normal, everything feels normal on that. And then when was your last bowel movement?
It was a few hours ago.
I'm also just gonna do hand hygiene before I go through that after touching your feet. It was a few hours ago?
Yeah.
Okay, great. And what was the consistency? You're not experiencing any constipation or diarrhea?
No.
Okay, great. And so I asked you, okay, so that's good. All right, now I'm just going to inspect first. And in the beginning, I would just inspect to note any pulsations, masses, or scarring, and I'm not seeing that. And then now I can auscultate, which I will listen to in all 4 quadrants. Okay, so I heard bowel sounds about every 5 seconds, between 5 and 15, so I would note that those are normal bowel sounds. At this point, I've done my inspecting, auscultating, so now it's safe to palpate. Have you been experiencing any pain or tenderness in your abdomen? Okay, at this point, I would just be palpating my patient, assessing for any distension, masses, or tenderness, and my patient was not guarding or doing anything that would alert me to that. So that part is complete. Have you been urinating regularly, and what's your pattern with that?
Yeah, maybe like 7 to 8 times a day.
Okay, great. And when you are urinating, is your pee, what color is it?
It's yellowish.
Yellow, okay, and is it clear or cloudy?
It's clear.
Clear, okay, great. And then you're not noticing any like particles or sediment or anything in there, okay? And then does it have any unusual odor?
No.
Okay, good. And then have you ever recently experienced any burning or urgency or any pain?
No.
Okay, great. Okay, so at this point I've done that. Now I'm going to just do some range of motion, musculoskeletal stuff. Before we get started with this, I just want to make sure that you are not feeling any dizziness or weakness.
No.
Okay, great. So I'm just going to have you swing your legs around if you don't mind. I already have her safety non-slip socks on. First, we're just going to do arms out to the side, up, down, and then do some little circle dances. Okay, great. And then lift your knees, and then kick out. Kick out. Oh, circles. Yep. And this one too. All right. Did you experience any pain with any of that? Okay, good. So I would note that her range of motion is adequate on her legs and arms. And now I'm just, okay. So when you're home, do you use any like assistive devices such as a cane or walker or anything like that to get around?
No.
Okay, great. And then for like doing every daily showering, bathing, cooking, cleaning, are you experiencing any trouble with that, or is that all with ease?
No.
Okay, great. Okay, so at this point, I'm just gonna have you, you're not dizzy or weak, correct? Okay, I'm just gonna have you stand up and walk towards there. And at this point, I'm just noticing her gait, which looks normal and good. She's not walking with any trouble. I'm also assessing her backside as she's doing this. You can sit. And seeing that she doesn't have any lacerations, bruising, scarring, or anything that would alert me that I would need to take note of. So putting my patient back into bed and making sure at this point in time that she is comfortable. I would make sure that the bed is lower locked, hand side rails are up, and then I would give my patient her call light. And I would assess the room for safety, such as pumps, tubing, suction, all of that. No IV lines or anything that anyone could get tripped up on. The side table is within reach. And then, is there anything else I can get for you at this point in time?
No.
All right, I believe that I have completed it.